welcome everybody. I'm delighted to welcome you today to this update around our area special educational needs and disability framework. We're going to do a couple of introductions. I'll take you through the agenda and then we'll get started. So I'm Claire Stewart. I'm Deputy Director at Ofsted for Inclusive Education. Before I bring in colleagues, I'll just sort of set out that our Area SEND framework is a joint framework across ourselves and CQC colleagues. So I'm really delighted that we're joined by colleagues from both organisations today. And I'm just going to ask everyone to introduce themselves. So Tina, shall I hand over to you?
Thanks, Claire. My name's Tina Pagett. I'm one of His Majesty's Inspectors and a Specialist Advisor for SEND and AP for Ofsted. I've been leading on the Area SEND framework and also lead and team and quality assure Area SEND inspections. Jess.
Hi there, good morning everyone. My name's Jess Taylor-Beirne. I'm one of the Children's Services Managers in CQC, so work closely alongside Tina, Julie and Claire and other Ofsted colleagues. Similar to Tina, we've been working on the framework, leading on these framework review and the changes, and also partake in inspections as a team inspector lead and quality assure as well. Julie, I think.
Hi everyone, thanks Jess. So I'm Julie Nye, I'm a HMI and Specialist Advisor for SEND for Social Care, and I am also one of the inspectors that complete Area SEND inspections. Thank you.
Thanks Julie. And I think Robbie, you're going to introduce yourself as well, aren't you?
Yeah, thanks Claire. My name's Robbie. I'm the Policy Lead in Ofsted's Inclusive Education team, and I'm here supporting my colleagues today with the Q&A session.
Thanks, Robbie, and thanks all for those introductions. I know everyone will be looking forward to hearing everything that you've got to share. So I'll just quickly whiz us through what's on the agenda. So we're going to be talking a little bit about the Area SEND review and why we undertook that. We're going to be sharing some of the things that we've heard and what we're doing as a result of those. And then we're going to talk you through some of our inspection findings in our 2-year summary, which will be really interesting. We've had a lot of pre-submitted questions, so thank you so much to those of you who've submitted those. You can also continue to add questions throughout the session. We've got quite a lot of people online, so we'll try and get through as many of those as we can. What we'll do now as we move into the main agenda is turn our cameras off so that we can focus on the content and to just help with people's bandwidth, but we will pop those back on at the end for questions. So I will hand over to Julie then for the first area of the agenda. Thanks everyone.
Thanks very much. Thanks very much, Claire. Next slide, please. So yeah, so first we're going to talk about the review of the Area SEND inspection framework. So Ofsted launched the Big Listen last year, and through this we heard about improvements that parents and carers, children and the sector would like to see to our framework, but also the frustrations with the system. In our response to the Big Listen, we committed to reviewing Area SEND inspections. The findings from this review were published on gov.uk on the 6th of June this year. We just want to say thank you to all of those who provided responses in sharing views for this. And also a thank you to those of you joining us today who have provided feedback and information as part of this review process. So our objectives for the review were to explore how we could enhance the experiences of inspections for children and young people, families and local area partnerships, to improve our reporting to be clear about our findings, and understand how our workforce can continuously be developing their skills, knowledge and expertise through experience and training. In the review, we focused on how we can enhance the existing framework through a series of carefully considered updates, but without introducing major changes, while we know the DfE are considering those bigger reforms to the system. The review focused more directly on engagement meetings, monitoring inspections, and certain elements of our full inspection practice, such as data requests. So, for example, the information we ask for on our Annex A, and also how we can enhance the skills, training and experience of our workforce to capture what we have heard through our inspections to date and the Big Listen. There are various areas of the framework that were not included in the review, such as making fundamental changes to the inspection cycle, inspection teams or the evaluation criteria. The next slide, please. So as part of the review, we held 26 external events where we engaged with children and young people, parents and carers, family representative groups, including parent and carer forums and charities, professionals working in education, health and social care services, representative groups from different sectors. We also surveyed our own inspectors and held roundtable events with colleagues from Ofsted and CQC. So I'm now going to hand over to Jess, who's going to talk to you about what we heard and what we are actually doing. Thank you.
Thank you, Julie. So against the first objective of how we can enhance the experience of inspections for children, young people, families and the local area partnerships, the main two headlines that we heard were that children, young people and families want more opportunities to share with inspectors, and that inspections are resource intensive for those local area partnerships and so could be more supportive. So if we start with the first point about hearing from parents, carers, children and young people, some specific examples we heard were around positive feedback around our focus in terms of the framework on the experiences of children and young people and their families, seeking their views, and also the inclusion of social care inspectors as part of the inspection team. But parents, carers, children and young people also told us that they would like more opportunities to share with inspectors. Some children and young people said they could better prepare if they knew what inspectors would ask during meetings, and also to consider accessibility of the survey and how widely it's circulated. They also told us while the purpose of engagement meetings could be clearer, they did provide a valuable opportunity to bring the partnership together to reflect on and discuss the impact of their arrangements on children and young people with SEND and their families. And those engagement meetings, which are hosted by both Ofsted and CQC, meant they did feel more involved in conversations with local area partnerships, and they had improved co-production in terms of local decision making and keeping that spotlight on SEND. And there was a concern that sometimes local area efforts might be focused on being ready for a range of inspections, and area SEND is one of them. And so the idea of where resources are placed rather than necessarily working on the area's challenges. So those things came up from parents, carers and their families. And then from local area leaders as well, we heard that inspections do take up a lot of their time, and that pressure could be eased by reducing the amount of duplication in documents and discussions. But they also told us about engagement meetings being an effective opportunity to bring the partnership together, but the clarity around the purpose of those meetings and content as well. Like we've said, a bit more clarity around the data requests, and that the feedback from families should focus on those more recent experiences as well. So in response to those and changes that we'll be making now, if we can move on, thank you. So about inspector time, so our monitor inspections, which are starting again, as we know, they were paused for a while, and we've got more inspector time on monitor inspections now. And we're providing more opportunities to engage with inspectors during full inspections in various ways, making our surveys more accessible and effective. So, for example, we'll provide our survey links directly to family and children representative groups to share with their members to support in the surveys being better circulated. Also looking at how we can better communicate with children, young people and their families and increase the focus on recent experiences as well with the inspectors. In response to inspections being very resource intensive for local area partnerships, which was a common theme coming through, we have simplified the data request that we asked for. So using existing reporting mechanisms in local areas, existing data collection and reports where available. So in the new published handbook, the data requests there are a lot more streamlined. We've also committed to making engagement meetings more reflective and proportionate, and we've updated our inspection handbook to provide that clarity around the purpose. And I think we've got a slide about that later to go into a bit more detail. And the frequency of engagement meetings as well is going to be based on the partnership's most recent SEND inspection outcome. In terms of that data request being streamlined, we have made some changes to Annex A data requests. This includes a new health commissioning template and some clarity on other information requests such as referral pathways. And then if we think about those engagement meetings, so the intention of the engagement meetings is to discuss the partnership self-evaluation, their SEND action plans, and how they measured that and the impact on experiences and outcomes for children and young people with SEND and their families, and also as an open forum to discuss any concerns or changes to the local SEND system. So it'll be looking at that SEF, that self-evaluation, any action the local leaders are taking in terms of actions outlined in the full inspection report, what local areas are doing to maintain or improve good practice, how local area leaders are monitoring the impact of their actions, and any kind of emerging local or indeed national SEND issues that impact delivery of services, and where we can to discuss the current area SEND thematic topics as well and any learning as a result. So the second thing that we heard about was around improving the clarity and impact of our reporting. So the headline we heard overall is that our reporting needs to provide more detail about outcomes and clearly assign responsibility to the partner who needs to address those areas for improvement or those areas for priority action. So parents, carers, children and young people raised some concerns that they felt their views were underrepresented, particularly when the outcome of an inspection was positive in a way that didn't reflect their individual experience. And some FAM reports had a lot of detail, were difficult to understand, while others in different areas and had different experiences wanted more detail. But there was definitely something around transparency about the findings and the basis for the outcomes. And local area leaders told us that Ofsted and CQC should do more to acknowledge that partnerships are working in a challenging national context. They did express concerns about being held responsible for issues beyond their control. The idea of having more information about the themes identified in inspection surveys to support their strategic planning. We also heard from across the sector that examples of good practice we include in our reports do help them to identify strategies to improve support, so therefore we should provide more examples. Again, sector representative groups said about more information in terms of the survey results, and like we've already said, many people across the sector said our report should clearly assign the responsibility for those areas that do need improving. So as a result, the sort of changes that we'll be making is to be clearer on the lead for improvement areas where appropriate, and specify which member of the partnership should take these forward. We're going to be exploring how we can make our reports more accessible for children, young people and their families, and share a summary of our survey findings with local area partnerships and the family representative groups in order to support that strategic planning. And in the longer term, and following the Ofsted wider improvements to education inspections, to explore the introduction of a report card for those area SEND inspections, but that will be after the first cycle of inspection. So when that ends in December 2027, that will be something to explore. And then the third aspect was around how we can continuously develop the knowledge and skills of our area SEND workforce. And given how complex the inspections are, that inspectors would benefit from enhanced and additional training. So we heard some feedback about the positive ways in which inspectors engage during the inspections, including speaking directly to children and young people. And many respondents valued the collaborative approach that inspectors work in, and that their professional insights help to drive further changes. But there was also that feedback that many people told us that the area SEND inspection teams do need to have a more comprehensive understanding of SEND across education, health and the social care sectors. Some other things we heard, more specific things from parents, carers, children, young people, said that children and young people did feel comfortable talking with our inspectors, meaning they could share their thoughts on what was working well for them, and how things could be improved, but that inspector training should provide a firmer understanding of how the family representative groups function, so often the parent carer forums, and how they can support inspections, but also how this may vary across areas. And local leaders told us that training for our inspectors should include further legislative underpinning of the framework to help form an understanding of the entire SEND and partnership system as a whole. They wanted our inspectors to have experience of whole system working and leadership, and a robust knowledge of the national issues and contexts within which local area partnerships operate. So in response to that as well, and just to clarify, so our inspectors currently do have a fairly intense period of induction, including shadowing experiences, intensive training over a number of days. So this is really enhancing on that and building on that existing training. So as a result, we're going to be increasing the frequency of that training for new and existing inspectors throughout the year. And updating and enhancing it, which alongside Ofsted we'll be doing this summer. So starting in the autumn term, we'll be providing additional refresher training for our inspector workforce. This will ensure inspectors understand monitoring inspection methodology, the engagement meetings as well. And so we'll be updating them on all of those changes. One of the other things as well, which Ofsted are going to explore, is forming a national pool of Ofsted education inspectors. So similar to the approach already used by Ofsted Social Care and in CQC as well, we have a national team. So exploring this with the idea that we'll have more consistency and expertise in the Ofsted education teams as well. But also that continual work with the new Ofsted Academy to continue recruiting Ofsted inspectors and HMIs, His Majesty's inspectors as well, with relevant experience in SEND and alternative provision, as well as continuing to recruit colleagues who work in local area partnerships. All of our inspectors at the moment do have that experience in the sector directly, a lot of experience in SEND, some have lived experience as well. So continuing to build on all of that will be really, really key. And so I think it's time to hand over to Tina now to talk about the inspection findings over the first 2 years of the new framework. Thanks, Tina.
Thanks, Jess. And just to add to that, inspectors on this framework have SEND backgrounds, and that is absolute a requirement for inspectors to undertake training and lead and team on these inspections. So if we look at inspection outcomes, as at the end of May, we published 62 reports, and around 25% found that local areas SEND arrangements typically lead to positive experience and outcomes for children and young people with SEND. 50% found there were inconsistent experiences and outcomes, with that final 25% finding widespread and or systemic failings. And that data has been fairly consistent throughout this cycle of inspections, where we've got that sort of 25% sitting with typically positive, around 50 inconsistent, and 25% changes slightly, but it's been fairly consistent. By the end of this term, we'll have inspected half of the local area partnerships and be on track to conclude this first cycle of inspections in 2027. We do want to acknowledge the current changes to ICBs, those ongoing local government reforms and reforms to the SEND system. We are commissioned by DFE for this framework, and we're committed to continuing to deliver the Area SEND framework to shine the light on the experiences and outcomes of children and young people with SEND and their families. But as ever, we'll work with sensitivity and work closely with those that we inspect. Each local area, has different, sort of different changes taking place, and we'll continue to be sensitive to those and take that into consideration. So, alongside the review of the framework, we also published a report that summarises what we found during the first 2 years of inspecting under this current framework. And that's typical with any new framework, that step back and have a look and what have we learnt in the first 2 years. It helps to inform any future improvements to the framework, but also to the system, and by highlighting examples of effective practice and identifying challenges. And that's what we heard a lot through the review, that people wanted to hear and see those examples, and Jess has highlighted that earlier. We recognise that the SEND system is under significant pressure. We've recognised that throughout this framework. Some of the factors that contribute to this pressure we recognise are outside of the control of anyone in that local area. In our inspection reports, we consider areas where leaders do have the power to bring about positive change, and where they are really facing those national barriers. So the report highlighted 8 broad themes of both stronger and weaker practice, and that was kind of consistently emerging through the reports that we published in the first 2 years. So you can see some of them highlighted here. And if we move to the next slide, we've got some more on the next slide. So if we highlight a few examples of stronger practice in some areas, there was examples of strong oversight, co-production and joint commissioning arrangements. With inclusion strategies that have been co-produced with families and the Parent Carer Forum or Parent Carer Rep groups, coming along as equal partners. We saw really good use of feedback from children and young people and their families that were also supporting and informing those commissioning arrangements. We saw strong examples of local areas working collaboratively and sharing information across health, social care and education to fully understand the needs of children and young people and to provide the support. And meaning that services were well coordinated and were commissioned effectively. The reports found effective early identification and early help, with examples such as communication advisory services, family hub drop-ins, really creative strategies to supporting children and young people in their families whilst they wait to access services, and a lot of that from the sort of voluntary sector. Successful monitoring information and quality assurance processes to create the sort of better quality and timeliness of EHC plans. So although there's lots more in that report, that's just a few sort of headlines to support those themes for stronger practice. In terms of some examples of weaker practice that we found in the reports, delays in responding to rising numbers and increasing complexity of cases of children and young people, and not assessing needs when commissioning, leading to sort of gaps in provision. We also found poorly planned and managed transitions that were also leading to gaps in provision, not knowing what was needed and therefore not having the provision there to support. We found limited co-production, so although we found strong examples of co-production, we also found really limited examples of co-production. So late consultation with families, impacting on the quality of education, health and care plans, and not capturing the child or young person's voice, and frequently insufficient contributions from health and social care professionals, all resulting in inaccurate identification of needs and inappropriate allocation of support or accessing the right services. The timeliness and quality of education, health and care plans identified as an area for improvement in 69% of local areas inspected, and as an area for priority action in 71% of those local areas that had a systemic outcome. We found no effective joint strategic needs assessments in place in some of those areas, and leaders so therefore didn't have that information that they needed to sort of support shaping services around children and young people or making those improvements, and leaders not having that available data and information to really make those effective decision making about commissioning. So that's a few of the headlines really to support sort of stronger and weaker practice. But if you could go to the next slide, you can find more information on what we found here in the first 2 years of the reports. And we specifically asked through that consultation to make sure that we were giving you lots of examples and you wanted to learn from those examples, and you'll see that here, as well as findings from the review that Jess has just led us through, and the updated handbook that supports that. And the changes that have already been made as a result of that review, which has been absolutely invaluable. You can read other, published reports and things that we've referred to here as well. So the QR code will link to this presentation, and therefore you'll have access to those links as well. So if we move on to questions now.
Thanks, Tina, and thanks to all the presenters. I'm going to move on to the Q&A session now, and we've had loads of really good and interesting questions submitted, so thank you all for those. I hope that some of those questions will have been answered by the presenters after the question was posted, so I'm going to focus on those questions that perhaps received a little less attention during the webinar. And the first question I'd like to put to the panel is, does the rise of children and young people out of education concern you? And what do you think can be done locally when it's a national issue?
Shall I take this one, if that's all right? So we are concerned by the rise in children and young people with SEN not in school. And for that reason, that's why we launched the thematic visits on looking at children not in school. So over the last year, we've been going to 6 different areas to look at those children. It's been looking at the enablers and barriers to children not being in school, push and pull factors to explore their experiences in detail. And towards the end of the year, we'll be pulling those findings together in a report with some recommendations as well. So keep an eye out for that towards the end of the year.
Thanks so much, Jess. Next question I've got on pulled out from a list is how do Ofsted and CQC ensure that the needs of young carers are addressed, including those that are very young?
Thank you, Robbie. Shall I take that one? So Ofsted's other inspection frameworks require inspectors to explore how the needs of young carers are addressed. So, for example, in our ILACS inspections of local authority services, the framework was updated last year and amended to refocus for the experiences of young carers, and that's outlined in our National Director for Regulation and Social Care, Yvette Stanley's blog that was dated March of this year. So there's more information there. And in area send inspections, we do explore how local partners, so for example, schools, health and social care work together to help to identify children with a range of needs. For example, there may be a child with special educational needs who may also be a young carer within their family. We take into account the child's family circumstances as a whole and how children and their families' needs are identified early and how that support is coordinated.
Thanks, Julie. That's really comprehensive. I'll move on. Maybe this is a quick one because we did mention Annex A data expectations during the presentation, but I was wondering if we have any more to add there, given that we've had a few questions on that. Particularly do our findings from the review have any impact on our data, Annex A data expectations?
Well, we've condensed the Annex A data requests. I mean, this is something that we heard a lot in terms of that kind of burden on inspection and the amount of work for local areas and the pressure. So we've gone through the information requests and looked at what do we really need, what can we not do without as part of this, and also taking on board what local areas have said about and what they want to be able to provide to us. So we have reduced that down and provided more information on the person level data that we ask for through the template, some frequently asked questions there to support some of the questions that we get around the data, and how that should be presented. It should be that the format that you already have it in. We don't want to cause additional work, and we've published some examples of that. But interestingly, I think we asked for about 60 pieces of information, but we've just hit an all-time record with over 1,000 documents uploaded for one of our live inspections. So even though we're asking often for that more limited amount of information, we do get an awful lot of information uploaded. So you'll hear inspectors asking, just to use that Annex A data and save lots of work for everybody.
Thank you so much, Tina. If it appears as though I'm not on the screen, it may be because my camera is not working, but don't be alarmed, I'm still here. And I'll move on to the next question, which is one for the panel here. Are Ofsted and CQC taking into account the impact of current changes to health and ICBs in particular when we're inspecting local area partnerships?
I did reference it, but Jess, you might want to add more on that.
Yeah, absolutely. I think it's really key that we do reference this here to everyone, and in other forums, when we're speaking to ICBs, to NHS England, etc. As inspectors, we're very much aware of and sensitive to the impact of the changes. We know things are changing quite quickly. There's a lot of unease out there, and we also know, a lot of the roles that are existing in ICBs will be impacting send arrangements in a local area as they change over the next 18 months or so. So very aware of it, and like I said, keep up to date with NHSE and ICB reps as well in terms of their own changes. But the vast majority of our inspection work does involve speaking to frontline professionals. So those that work direct with children, young people with SEND and their families as well. So we're very much committed to continuing to work sensitively with colleagues in all of our work, in all of our inspection activity, to ensure that we still manage to accurately reflect the experiences of children and young people with SEND at a time when there is significant change as well. And our inspectors are all very much aware.
Thanks so much for that, Jess. And maybe just while we've got you here, perhaps this one is also for you. We've been asked if we can tell participants a little bit more about the relationship between inspections and the dynamic support register.
Yeah, absolutely. So it's something that we always look at when we're on inspection. So just for reference, the dynamic support register is a key requirement within local areas to support autistic people or those with a learning disability when they're at risk of requiring inpatient treatment for a mental health crisis. So our inspectors will often look at how the DSR is used effectively, the links between the adult DSR and the child, the sort of 0 to 18 ones, any crossover as well. And we look at those as an example of proactive risk monitoring in an area. And we know that effective use of a DSR, when we look at it in terms of these area SEND inspections, can really demonstrate how well education, health, social care work together when those children and young people or young adults are in crisis. So it is something that we will always be looking at and reporting on.
Brilliant, thank you, Jess. I'll open it out again. A question, I think, from a local area partnership regarding how they can better evidence the outcomes of their collaboration with external partners like health and social care partners.
Should I take that one, Robbie? Thank you. Sorry, I'm having problems with my camera as well. Apologies. So, I mean, the local area partnership's responsible for providing that evidence to us on inspection about the impact of its arrangements for children and young people. So that might include providing us opportunities as inspectors to meet with relevant managers and other local area representatives to make sure we've got the appropriate information and data. So, for example, the needs analysis of outcomes for children within their local area who have special education needs and disabilities. It's not an exhaustive list. It may be that we could ask, as well as the Annex A information that we've talked about, there may be additional information that we might need to help us to understand that collaboration with partners. But we need to be really clear that it's got to be necessary to give us an accurate understanding of those children and young people's experiences. It's got to be within the scope of the inspection. And that it's part of the local area's business as usual. We don't want to create more work, so we don't want something devised specifically for inspection. And inspectors will gather evidence that's balanced and connected to form a picture of the typical experiences and outcomes for children and young people within that local area partnership. So yeah, thank you.
Thanks, Julie. In case others couldn't see, I was nodding along in agreement. Hopefully the next one's quite a quick one, but just a clarification really. How many multi-agency audits should be completed in week 1 of inspection?
Shall I take that one, Robbie? So it's about that. So these relate to the case tracking of 6 children and young people with SEND from a wide range of ages and needs as well. We try to get a really representative sample, and they'll have different levels of involvement from education, health, and care. You'll see in the handbook changes or the guidance in Annex A that that's where we've streamlined some of the requests. So it's a multi-agency chronology now rather than audits plus chronology. So it's under that audit section with the idea that there's a multi-agency chronology of events for the child or young person as well. We don't have a preferred style of multi-agency audits. That was some feedback as well in the consultation with different colleagues from different sectors. Some wanted an audit template, some didn't. So we've kind of stuck with the majority of not going for an audit or chronology template, and it's up to the local area. So hopefully that will have been streamlined now, but it is for those 6.
Thanks so much, Jess. That's really, really helpful. And perhaps the next one is for you as well. Could you tell us a little bit more about the role of health colleagues in the updated inspection framework, please?
Yeah, so I think with the new framework, the changes we've made don't fundamentally constitute a new framework. I think, like one of my colleagues said earlier, there were lots of things not included. So the framework in terms of how the inspections run and the inspectors out on site for our full area SEND remain the same. So area SEND inspections are still carried out jointly by Ofsted and CQC. So our inspectors specialised education, health and social care will work as one single inspection team to gather evidence from across the partnership. So that hasn't changed.
Bro, thank you, Jess. I'll open it back out again. A question here on section 19. How will we hold schools accountable for providing suitable education under section 19? Who'd like to field that one?
I can take that one. In terms of area SEND inspections, we're focused on evaluating the outcomes and experiences of children and young people with SEND, and that does include those that are unable to attend school. So we look as part of the framework at how the local area is supporting them in line with those S19 duties. And where we do see weaknesses such as delays, long delays, unsuitable provision, a lack of oversight of children and young people, then that's where it can lead to a priority action being issued as part of that inspection outcome.
Thanks, Tina. That's really helpful. I'm conscious of the time, but perhaps we got time for one more question. I'll ask the panel, what is the future focus of our inspections and other activity for autistic children?
I'll take that one, Robbie. I mean, as we've said earlier in the presentation, we have been given that clear directive that we will continue inspecting local area arrangements for children and young people with SEND, and that obviously includes children and young people with an autism diagnosis. So, under this framework, that we're commissioned to deliver, we will continue, to inspect, and we make sure. Jess talked about the case tracking. When we're on inspection, we often look at the sort of lived experience through our sampling of over 100 children and young people in that local area, and speaking to them, parents, practitioners, supporting them, and making sure that we're speaking to sort of children and young people that have a broad range of diagnoses and needs, and they will continue to be our priority in this framework, their experiences and their outcomes, and how local areas are coming together to work to support them.
Tina, thanks so much, and thank you to all the other panelists for those answers. Really useful, and thanks for keeping things so succinct. We're bang on time for me to hand over to Claire. Just before that, I'd like to thank everybody who's attended for submitting these questions, and I do apologise for those that we haven't had time to get round to, but hopefully we've kind of covered off the main themes of what you'll be interested in this Q&A session. Claire, take it from here, please.
Thanks so much, Robbie. We won't pop the slides back on, but when you get the deck, you will see that there are links to our online presence, social media, so you can find us on there. I just want to say, just to echo a huge thank you to our panelists for sharing all of that information and for answering all of those questions, and a huge thank you to everyone for attending as well. We hope you found that really useful. You'll get the slides and the link to the YouTube as well, so please do share those. And I just want to say, finish by saying thank you to everyone on the call for all of the work that you do for children and young people with SEND and their families. Thanks a lot, everyone.
Thank you.
Thank you all. Goodbye.